You know who makes sure that everyone has a good hair day? Dr. Chaffoo. A new study says, Doctor, welcome by the way, and happy belated Father's Day to you. You have 6 little ones running around, so you're busy.
Last time I checked, exactly,
we appreciate your time. Sure. So Brad Wills was in here a few minutes ago talking about a survey. Sure. Women, 78% of women say that they kind of like a dad bod. It shows confidence in men. This is interesting, right?
It is interesting.
Yeah. If we don't want a dad bod, though, and we want to look like, you know, some guy from GQ magazine, because summer beach weather is here. Yes. We're talking about male plastic surgery today. We talk a lot about women in plastic surgery, but we want to talk about men in plastic surgery. The top 5 procedures, I found this interesting. Let's roll through the top 5, okay? Rhinoplasty, nose jobs, right?
Exactly.
Eyelid surgery, liposuction, breast reductions, and hair transplants. So let's take these one at a time. How many men are getting nose jobs?
So, you know, Chris, it's interesting. Last year, there were over 200,000 men that got a surgical procedure, and of those, probably about 75,000 got rhinoplasty. And those are obviously general guidelines, but quite a large number.
Interesting. Eyelid surgery. What is this? Is this the same thing as an eye lift?
It is essentially where we're removing the extra skin from the upper eyelid or the fat pads in the lower eyelids. We're treating those, making the eyes look just a little bit more youthful.
Okay, liposuction. We have some before and afters, and we look at the next 3 or next 2 things. Liposuction. Is this liposuction?
This is. And men, as you said earlier on, you know, we're looking at just making some improvements in contouring, some changes, giving a little bit more definition along the size of the muscle. The love handles are a common area that men suffer from, that collect fat that we can treat with localized areas of liposuction.
Women tend to put weight on in their,
the saddlebags.
Yeah.
The thigh
Men
areas.
put it in their gut, right?
Yes, exactly.
What about breast reductions? What is this?
So, you know, as we all age, we tend to put on fat in areas that we don't want to put it on. One area is the chest. So one area is called gynecomastia, which is male breast tissue.
So
but it's also
man boobs.
Exactly. So that's pretty straightforward, treated with targeted surgery, including liposuction of those areas.
Question for you. As you look at this image, before and after, how long does the after last before it goes back to the before shot?
Well, that's a great question, because obviously you want to maintain your weight, you want to be careful about exercising, but the results are permanent if you take care of yourself after a procedure like that.
And then you do something called cool sculpting. This
sculpting
is basically freezing off the fat?
It is. It's a non-surgical, non-invasive, office-type treatment to permanently remove fat. It's FDA approved. It has the longest track record of any non-invasive technology.
So what do? You go to the office, and that's before, and then after. How long does it take to get to the after?
It takes about 2 to 3 months to get the outcome like that.
Where's the fat go?
So the fat actually is interesting. So these are external devices that are put on, Chris, and what happens is the fat cells are frozen, and then the fat cell gradually is removed by the body naturally. So you don't see rises in your cholesterol or any other systemic effects, but there's a gradual reduction in the fat in those areas.
Last but not least, you do a lot of hair transplants.
Correct.
Men are getting these more and more, right?
Yeah, they definitely.
And this is really your specialty. You're writing a book about this subject.
Yes, hopefully out in about a month or so. But it is something that, you know, for many years men were afraid of hair restoration because we've all seen the unnatural looking, the old clumps, you know, like
the G.I. Joe look.
The G.I. Joe look, and also this problem of a long scar on the back of the head. We're not doing that now. We're actually individually removing these follicles without leaving a long scar and creating a normal, natural hairline.
And real quickly, the future of hair transplantation is stem cells?
It might be. You know, one of the things we know about stem cells is that they tend to be able to differentiate into any type of cell. So I'm working with a company actually in Southern California as their medical director, and we're studying this. We've already been able to show in an animal model that we can actually grow the hair cell. We've now actually implanted that into a mouse and grown hair from that. So our next phase will actually be FDA studies where we're going to look at how successful it can be done in humans. But if we can do that, indeed, it'll be a game changer. We'll be able to recreate a hairline from before you began losing your hair.
So every man will have the same head of hair he had when he was 16 years old, ostensibly in the future.
That's our hope.
That's unbelievable. Dr. Richard Chaffoo, thank you so much for your time.
Chris.
Really appreciate it. Good seeing you again.
Good seeing you too.